Welcome to Bid on You, the show for the girlies building the life, love, and career they actually want. So, if you're ready to bet on yourself, don't be silly. Join the community.
Welcome back to Bid on You. Today's conversation is one I've really been thinking about for a while. As a big proponent for therapy, I think we should all be as educated as possible, but I do feel like we're using therapy language now more than ever. And I don't know that we're always using it correctly. So everyone's always triggered and at capacity and everybody's toxic. And today we're going to get into what these words actually mean, how they're showing up in real life, and how we can use them in a way that actually supports our growth instead of holding us back, with an actual professional psychologist, Dr. Brianna Morgan. So stick around and let's start the show if you're not at capacity. So I feel like I'm like Dr. Bree, which I never call you, but now I'm going to do for the rest of the episode. So here we are. So we're so excited to have you. Tell the people a little bit about, like, not to be like, what's your resume, but a few credentials just so they know we're not just in here yapping as normal. This is a professional person here.
Yeah, so I graduated from University of Florida with my
Period.
bachelor's
Boo.
in psychology.
Just kidding.
I know, right? We're
We'll
rivals.
insert booze.
We're
We'll
low-key
insert
rivals.
booze.
Okay. And then I got my master's and my doctorate in clinical psychology from Biola University. So, yes, I graduated in 2023, did my postdoc at the VA.
Okay,
and
wow.
Yeah, now I'm here.
Amazing. How was the VA?
The VA was amazing.
Really?
I loved it. Yeah.
Okay, wow. See,
Yeah.
I think it's really interesting when people have a certain skill set
Mhm.
because it's like God has gifted you for that. Like, because the psychology of it all, and then at the
Absolutely.
VA, I would be like crashing out because I'm such a sensitive spirit.
Yes.
Like, I think I'd be a great therapist, except I'd carry everything that people tell me after.
Yeah.
So, not great.
I just had a patient ask me, we had a heavy session, and she was like, how do you not take any of this home? And I was like, honestly, I think part of it is I'm equipped to do it. Like, it's part of my calling. And I think people who are called into this field have a natural inclination to be able to walk with people and hold their darkest things. And then honestly, it just comes with time. Because in the beginning, I definitely was like, ooh, it's still
I'm going
weighing
to lay
on me.
down.
Yes, yes.
I'm laying down the rest of the day. Thank you so much.
Yeah.
Amazing.
Mm-hmm.
So with that, I feel like therapy, I'm such a proponent for therapy. We're such a proponent on the show. And I feel like it almost trickles out naturally. Like if you people that like really go to therapy be like, well, here's what I've learned. Even if you
Yes.
don't mean to.
Yes.
And maybe the intention began positively, but I think like on the interwebs, everywhere you turn now, it's like therapy language, like triggered, at capacity, gaslighting, like all of these terms that
Yeah.
originated from what you went to school to learn about, right? Not just what I saw a TikTok of and
Exactly.
started repeating. I'm guilty of it as well. So I'm here to learn as well today. But since therapy language has become so mainstream, and you have the actual education as to what the words really mean, what do you think happens when people sort of learn the terms
Yes.
without fully understanding them and what they mean?
Yeah, that's a great question. I think the topic of mental health in general has become more accepted, right? And more normalized, which is great. And social media plays a huge role in that. And I think honestly, it could be that people are learning what mental health is or having conversations about it for the first time through social media just by scrolling and seeing something. And I think there's a part to that that's good because there is still a stigma, even though it's gotten a lot better. When it comes to the terms and the labels, I think labels can feel very validating, right? A lot of times people are looking for an answer to what they're going through or what they're seeing, either in themselves or someone else, right? Why is
Usually. Finger pointing at you,
Listen.
yeah.
Yeah, so labels can feel very validating, but I think on the flip side of that, when you're getting your education, you're learning from somebody who is simply talking about their subjective experience, like I went through this and this is what I was labeled, and then people start to
Come
pick
on.
up on that,
Wake that up.
and
Because I'm like, well, maybe I have that
right,
every day.
I think
Like
it's
literally, it's like Taylor Frankie Paul on Mormon Wives, and someone's like, she's splitting, and I was like, do I split? Girl, what does that even mean?
it's
You know?
yes, it's a natural tendency.
Okay.
And if I could have a Kanye moment, y'all not doing the education,
Hello?
right? Like
Just saying the
I think
words. Just repeating stuff you hear
exactly.
like a child.
Exactly. Right.
Okay.
So I think it's one thing to share about your experience. It's another thing to start teaching as if that is fact.
And that'll preach. That's a whole other episode. But let me stay locked in.
Right.
Hello?
Yeah. So it's one thing to share about it. And I think when you start to get into the realm of teaching people of like, this is what it is and this is what it looks like. Meanwhile, you haven't walked with anybody through that. You haven't treated anybody for that.
You wouldn't know how to treat them.
Right.
Because you don't have the education. Right. Hello. How can you diagnose somebody from a reality show, for example?
Right.
You don't even know that. You literally don't know them. So
Exactly.
let alone you've assessed them. And I'm sure there's actual things that you guys do when you assess people.
And that's so funny because that's one of the things that they taught us in school was someone you've never met. You can't assess them and say they have some type of diagnosis or disorder. I mean, we can speak to flavors. We can speak to like some symptoms, but to give someone a diagnosis at all, it kind of feels like conjecture. And I know social media is for the clicks and for the likes and etc. And so I think people will start to say things and do things to get a following, get a reaction. And so there's responsibility that comes with the platform. So I think for people who are the consumers on the consumer end, making sure you're also doing your homework too. Yeah.
Before you start like integrating things into your vocabulary.
Exactly. Exactly.
And I think that brings up an interesting thought for me of like almost like colloquialisms that we know typically come from like the Black community, right? But then they get deemed as Gen Z speak or like internet speak, right? And then it becomes a part of your vocabulary. So how you might start saying, oh, that, or even like that's tea, right?
Yes.
I say that all the time, but I never was like, I mean, I try to know what's going on. So I was like, okay, this came from the LGBTQ plus community and Black women, etc. But most people just are like, tea. Ooh, Chile. You know what I'm saying? And so it's like, if you won't even do it for something that minor and like know where that comes from, you're 100% yelling out triggered, gaslight, manipulation, all of those things without giving it a second thought.
Yeah, I think when you start to take it on as an identity, it's like these labels of, you know, I feel like more recently I've seen a lot of people questioning if they have ADHD, questioning if they're on the autism spectrum.
Everybody's like, I'm on the spectrum,
Right, because they might have flavors or they might know.
What's flavors?
Flavors is like, there might be a symptom that aligns with it. And flavors is something I made up.
Came
like,
up with.
Yeah,
okay, I love that. I was like, flavors? Look at me learning and asking about the word because I was about to run with it. I caught myself.
No, like you have a flavor of it, meaning like I can see some aspects, but to be clear, right, when we're talking about these diagnoses, these disorders, there are a cluster of symptoms that you have to meet criteria for, right? And it has to be over a certain period of time, etc. There are several things that we look at rather than just, oh, you have a symptom or two. Let's go ahead and give you the diagnosis.
And get you on some medication or something.
Right.
Yeah.
There is an objective kind of guardrail that we look at in terms of diagnosis. So again, for people to just be like, oh, I have one or two symptoms, or I have difficulty concentrating, so it's got to be ADHD. I interrupt people. It's got to be ADHD. And it's like, okay, and there are several other factors that
we would need to check off.
Exactly. That go into an actual diagnosis. So when people start to take it on as an identity, I think it can lead to lack of accountability, right? Because then they start to place their behaviors and the reasons for their behaviors solely on this label that may or may not even be accurate. So, yeah.
Do you feel like there is, because now this is just, I'm going off script, so flow with me.
Okay.
But I'm curious why there is that urge to, and I guess I can look within, that urge to cling to something and say, oh, this kind of explains my behavior, or this explains why I feel things so deeply, or why I'm experiencing said symptom.
Yeah.
Like, I wonder if people are just desperate for understanding because that makes the thing less scary, at least for myself. I'm an intellectualizer.
Yeah.
And, you know, everyone's like, you're so self-aware. I'm like, it's painful. But it's like, I can go into therapy and tell you every single thing, tell you where it comes from, tell you why.
Yeah.
But am I actually like feeling the thing and moving through it? Probably not. So I think maybe people, it removes the fear when you feel like you can label it.
Yeah. And I think a lot of people stop at labeling it.
Hello, I hope y'all are listening. We need to zoom in.
They like to stop there. And
it's because I have this, therefore I'm doing nothing to change it.
Exactly.
Yeah, that is my biggest pet peeve. Like, if you know that's your problem, let's get to the solution. Like,
right. And I think there's a deep-rooted desire to make meaning of things and to understand, like you were saying. And I think this is one of the ways that people try to pursue it, right? They want to be able to understand, why do I keep engaging in this maladaptive pattern? Like, let's label it this. And then accountability goes out the window because I have this disorder. And so, I can't really do anything about it. And I think sometimes, like, a misconception of what therapy is that, yes, you're going to feel seen, you're going to feel heard, as you should, right? There's a lot of healing just there, but it's also about building insight, right, into what's going on, into your patterns, and equipping you with the tools and the skills that you need to be able to change those maladaptive patterns into something that's more adaptive. And there are plenty of ways that I think people can be misinformed about what therapy is or what goes on in therapy. It could be TV, it could be any form of media, it could be your friends, right? Where I think they feel like they're coming just to talk about their problems, right? And the part that is missing sometimes about their understanding is, oh, we're actually going to work on changing.
Spoiler.
What?
Why? Leave me
That's
alone. No,
crazy.
literally, yeah.
But there's a lot of work that goes into that. It's a hard process. It's a painful process a lot of times. And you should be feeling yourself stretch in therapy. If you're not, yeah.
And I think that kind of brings us even back around to, like, this can be for someone trying to go to therapy or someone who's not even planning to, but is going to continue to use these words in their vocab. So I think two big ones are, like, I'm triggered and trauma, right? One usually is like, I'm triggered because of my trauma, all of those things. So I'm curious if we can have a top line definition of, like, what does it actually mean to be triggered?
Yeah.
And how is that different from just having a bad day or someone annoys you or you're uncomfortable, right?
Yeah.
Everything is I'm triggered. And I'll even say this, like, from trauma. And I've heard someone say before, like, trauma doesn't have to be this catastrophic thing, that people would define it as. If it affected you in this way, shows up in this way, then that can be trauma. But if you disagree, do let us know. But yeah, I think the two go hand in hand. So I guess defining what actually is being triggered and what actually is trauma that creates a trigger.
Yeah, that's a good question. I feel like when it comes to being triggered or feeling triggered, in its most simple form, it's an emotional reaction to a stressor or an event, something that happened, right? And I think it happens on a spectrum as well. Trigger is it's a strong word.
That's what I'm saying. Everyone runs with that.
Yes.
Like, oof, I'm feeling something. Just say I'm feeling something.
Right.
Just say I'm feeling something. I'm going to start saying that. I'm feeling something.
I'm feeling something.
I'm feeling it. I don't know, but I'm feeling it.
Yes. Yeah. And I think, again, it happens on a spectrum, right? So there's a level of intensity to which we can feel this emotion. I think, again, to be triggered is to feel something in response to an event.
Got you. So you think that it is okay that people are saying I'm triggered?
So what I'm saying is that being triggered happens on a spectrum, meaning you can be triggered by the smallest thing, right? Like, this person forgot to put the cap on the toothpaste.
I'm
triggered, right?
Yeah.
That means you had an emotional response.
Interesting. Okay, so they might be getting that one right.
Okay, in a sense.
Yeah.
Because I think based on your perception of what that means, that the person didn't put the cap on the toothpaste.
On. Teach these people.
Right. Based on how you perceive that, to some people that can feel like a response that's just completely out of the blue. Like, why is this so triggering for you, right? Versus a traumatic event, right? That has more emotional valence. And so, yeah, I think it's on a spectrum. Yeah.
I love that. And then what qualifies as trauma? And do you think it's kind of a doubleheader? what
Yeah.
qualifies as trauma, and I think is might be similar a spectrum, but
Yeah.
also not to spoiler alert it,
Mm-hmm.
but what is the difference between everyday challenges or just like
Yeah.
growing pains or experiencing life? Look outside,
Yeah.
war,
Yeah.
gas prices, all of that. What's the difference between like the two? Or I wouldn't even say the difference, but what is the
Yeah.
risk with labeling everyday challenges as trauma?
Yeah. So when you think about trauma, right, it's also similar to being triggered, right? The trigger usually is in response to maybe being reminded of the trauma, etc. But trauma is an emotional response to an event, like a very distressing event, right? So, and typically that event exceeds our coping skills, right? So when we don't have the skills to cope with said event,
Yes. Okay.
it typically feels traumatic, right? There's some sense of loss of control. There's some sense of a loss of freedom, right? To be able to effectively change the situation. It's almost like the situation kind of happened to us
Not me about to
without,
cry. Is this, I'm feeling something instead of saying triggered. That
with,
really was hitting me. Go on.
yeah, without our consent, right?
Yeah.
So that is a trauma, right?
Okay.
So something happened to me and I didn't.
Not
you
me
got
celebrating
something
trauma.
right.
I'm just like, okay, I'm not wrong on some things. Go on.
Yes.
I knew it. Okay.
Yes. So I think trauma is also subjective, right? We do have an objective definition of what constitutes a trauma. In reality, though, the same experience that one person might experience as traumatic, like person A might think that was really traumatic. Person B might be like, oh, I didn't perceive it in that way, right? One of the examples that I give patients sometimes is if we're both standing at the edge of a pool, we both get pushed in. You know how to swim, but I don't.
Great example.
You have coping skills to get out of that water,
Mm.
and I don't. So, of course, it's going to be traumatic for me, right? And maybe not as much for you. So, I think when we're talking about traumas, of course, knowing that there is an objective definition of what it is and what it constitutes, because we do need those guardrails.
Right.
But also knowing that what one person considers to be traumatic may not be traumatic for another person. And that could be based on your prior history, your background, your environment that you grew up in, right? If you're used to certain things happening, you may not consider that to be traumatic. For example, disciplining in childhood.
Yeah. Yeah.
I feel like that comes up all the time.
It definitely does.
That
You're
comes up-
traumatizing your child from spanking them, and then other people are like, they need to be spanked. Yeah.
Right. Or like, that's normal, in some cultures. So what might be traumatic for some people is not traumatic for everybody.
Interesting.
Yeah.
So do you think we're almost generalizing things too much to say like everything is trauma?
It can be, because going back to the labels and the desire to make meaning of the situation, right? If we're labeling everything as traumatic, it can also create this lack of accountability, right? Where we're not really getting to the core root of the problem. When we think about triggers, I think it's important to think more so too, like how you're responding to those triggers and what about that is so triggering for me, right? Rather than, am I using the word correctly? Am I defining it correctly? Also, if you feel like you're triggered because of the toothpaste cap, let's talk about it. Like, what about that feels triggering? What about that is evoking a strong emotional reaction? Let's get to the bottom of that. And maybe that has to do with, it's really not about the toothpaste. It's really about what happened when you were 8 years old.
Right.
And something about that is coming up when you see that toothpaste not connected to the tube.
That's gnarly too, because I feel like I was saying this the other day, like literally basically 15 years of your life defines like the rest of it in many ways. Not defines, but like it shapes so much of like how we exist. It's so funny to me. Like your childhood is like carrying you your whole life. It's kind of insane, but hey, I'm not in charge. I think that what's coming to mind right now is like, okay, pivot. Maybe it's not so much, hey, you guys are just using words, you don't know what they mean, but it's like, let's get to the root of why I'm using that word.
Yeah.
It's kind of what it sounds like you're saying.
Yes. And I think therapy, mental health in general, is a lot of turning the mirror to yourself, and it's a lot of introspection, which is the hard work of therapy, because A lot of folks sometimes they want to come in and talk about everybody else but themselves, right? As if the therapist has the power to change people in their lives. Or it's like, what I have the power to work on right now is who's sitting in front of me.
Ooh, wee. Well, in that note, I don't know why you said it to me. Y'all felt that. Why she tell me? In the similar vein, I think that is perfectly segueing into my curiosity also is like when everyone's like, oh, this relationship was toxic, this person is toxic. Like, how can you tell the difference between when we're not always flipping that mirror around when it's pointing, right?
Yes.
What's the difference between someone who's actually toxic and maybe y'all just aren't compatible?
Right. Yeah. That's a good question. I think one, knowing the difference between the two, obviously.
Step
Yes. Step
knowing
one.
what you're talking about.
Right. So when you think of like somebody who's toxic or in a toxic relationship, we've all had friends who have been in relationships that were just not great for them. So just even thinking about what that has looked like, whether it's, you're being manipulated, the person's jealous, they're dishonest, they're disrespectful, right? There are all these traits that either a person can show or that can be taking over the relationship that would indicate like, oh, this is toxic, right? Like it's not good for you. Versus incompatibility, when you think of what makes two people compatible or why we even choose the circles we do, we can think of if we put a romantic relationship out there, things like our values, right? Things like our goals in life. That's where we're starting to talk about compatibility. Like, are we a good fit? Are we a good match? So if I want to be married and you're like, I will never get married, probably not. Right? Or if you want to have children and I do not want to have children, those are really big things, right? Things like finances, right? If we have completely different visions for how we use our finances or how we even see the course of our lives going, that's more of a compatibility, right, issue. There can be all the love and all the care in the world for each other. And if we're not agreeing on these really important topics, it may just be that we're not compatible, right? I think one of the things that you can also look at too is in the course of the relationship, how are you changing, right? So if you're starting to
That's good.
change in ways that are more negative, right? It could be more of a toxic relationship, right? So the way you see yourself is being diminished because this person's jealous or manipulative or is trying to isolate you, right?
Like, what are the symptoms that are coming from that?
Exactly. Exactly. The way you relate to other people outside of this relationship, right? Is that changing in ways that are positive and ways that are not positive, right? So those are some things that I think you can look at to determine, like, is this a toxic relationship or are we just incompatible? But I think in any relationship, there are some things that should just be, in any healthy relationship, I'll say, there are some things that should just be standard. Like, we have mutual respect for each other.
Right.
Right.
We speak to each other kindly.
Yeah.
Like, whoa. Crazy.
Yes.
And what about like as an individual? I guess that translates, but like when someone says a person specifically is toxic, like they're not maybe dating them or whatever, but they're like, she's so toxic. Like, I feel like that's said a lot too.
Yes. And I think a lot of the same things can apply, right? What are you seeing that you feel like this person is toxic, right? What are some of those things? Can you even name them?
Right.
Or
without just saying that.
Are you being triggered by something else, right?
That's good.
Yeah. So I think, again, a lot of it ends up being pretty introspective.
Yeah.
Where it's like,
all roads lead back to self.
what do they say? When you point the finger,
you got 100 pointing back at you.
Pointing back at you.
See, that's how I be in my head. You see what I be saying? You see what I mean? It's just in here, it's intense. I'm telling you. Speaking of that, let's say that I deem that someone is maybe not toxic, but like I'm in a place looking at self, right? Where I'm just like, ooh, I'm spread thin right now. Like I, have a lot going on, which is most of us. We live in Los Angeles.
Absolutely.
We're trying to make ends meet. We're trying to pay $7 gas. Like we're just tired, right?
Mm-hmm.
So how can someone tell if they're setting a healthy boundary versus avoiding something or like using phrases like I'm at capacity to not show up? I think something that really stands out to me that I will say social media has peddled, which I enjoy, is to have a village, you need to be a villager. And I think trying to strike that balance. Like,
Yeah.
how do you discern, I actually need to pour into myself and like breathe and not go to the birthday today, right?
Yeah.
Versus I just don't really feel like it, so I'm gonna say I'm at capacity to kind
Yeah.
of like use these therapy terms to excuse yourself or not have that
Right.
accountability that
Yeah.
you mentioned.
I think a big portion of it is self-awareness, right? Are you able to check in with yourself and really know what you need? Sometimes people are just living life, right? Like you said, there's so much that we have to do and focus on in the day-to-day that we don't take enough time to really check in with ourselves. And that's something I'm continually growing in.
I've got to start that. You ate that because that hit me.
Because it'll be like, oh yeah, the event is in 3 weeks. Like, sure, I can do it.
Mm-hmm.
And
Then it's in 3 hours.
And then, right.
All right, to see y'all next time.
And now I'm feeling like, I said I was going to do. Oh, okay. But I think a lot of it is being able to assess for yourself, what are your needs, right? And another part of it too is understanding to what you value. So if community and connection is something you value, yeah, you're going to be prone to engage in those things. And if it becomes too much at any time, are you able to set a limit for yourself and say, you know what? I think I need what I need right now.
Okay. Right.
Is a little bit of time.
Yeah.
Right. So maybe I skip this and go to that.
Yeah.
Or maybe I make it a quick trip. Or if everybody's saying they're going somewhere after the main event, I don't go to that.
See y'all. Right.
I'll see you later.
Okay, so I'm kind of doing a good job. Period. I feel like I very much am like, I like to show up for people as much as possible because I want people to show up for me.
Same.
Right? But I think like literally your birthday, for example, we can use. You came to my graduation party, period. And then I was like, I'm going to throw up because I think your birthday last year I was out of town. So like physically could not. And then this year I literally couldn't walk. And then I was like, okay, well, you said no matter what, hell or high water, you're going to get there. And I was like, Marissa, you cannot stand. You know what I'm saying? So it was like, even though it's like, I think sometimes I use that as an example to say like, you can value something so much.
Yeah.
And if you literally cannot do it, you know what I'm saying?
Yeah.
You just got to let that go. Like that's being at capacity versus like,
Absolutely.
okay, well, I could just lay on this couch and watch Summer House, you know?
Exactly.
And that comes up a lot for me. But then it's like, show up. There's it's kind of like working out. Like you rarely feel bad if it's not toxic, you know. Right. You rarely feel bad after showing up. It's just the getting there. That's the struggle.
Exactly.
I love that.
Yeah. And it's so crazy too because it's like sometimes what we think and what we tell ourselves, like, oh, if I don't show up to this person's gonna be so disappointed.
No, literally, you were like,
so
girl,
mad. Yes, like it is okay.
You're like, actually, please don't come. It'd be weird. Like literally limping around my party. Like, no, thank you. That would have been so strange. But at the time, I was like, I'm horrible. Like,
no, the things that we can convince ourselves of, oh, I'm not a good friend or I'm not a good person because I couldn't do this even though I said I would. And it's like, but that person's not even thinking that
like the show
for
went
a
on.
second.
Yeah, like the show will go
like
on.
It's always like you'll be missed.
Yeah.
And you have to take care of yourself, right? Like if you are literally
or you can't come to anything else.
If you're in physical pain, and I think anyone who would expect you've gotta fight through that pain to show your love for me.
Like telling you now, talking about it versus when I was over there on that couch, like grappling is so funny because it's just like hindsight, but also in the moment I was like, oh, it's so horrible. And I'm like blowing up your phone about it. I was like, I'm sorry. And you're like, girl, okay. Well, with that, how, I guess that we kind of answered it, but like showing up for others, that was my physical health. But how can you do that while still protecting your mental health? Like when you are at a place where you do feel spread thin, but maybe you do have that extra ounce of energy and kind of like weighing the two. Like, how can I protect my mental health while also showing up for people?
Yeah, I think it's a balance, right? Because sometimes we do have a greater capacity to show up for people, right? And then sometimes our capacity is much lower. And so again, being able to check in and be honest with yourself.
Start at self is
be
what I'm hearing
honest.
From you. Okay.
If we can be honest with ourselves. I feel like I'm also have the same kind of characteristic where it's like I love to be there for people. Actually, my love language is quality time.
Yeah, it's my second one.
Yeah, words of affirmation, quality time.
Same. Oh, I love that for us.
Yeah, so I like love spending time with people, even though I'm more of a ambivert. kind of like introverted, but but I love being around other people. But a part of me sometimes is like, I don't have a social battery to do so. And so I think I have to be honest with myself about that. Like, okay, when is it time to actually turn your phone off? I don't do that enough.
I never do that. I'm like, something's going to happen. They're going to need me to be Superman and fly into the city.
I usually do.
Like, literally is how I
They
act.
might. No,
I see, and now I'm getting
where's
hot.
the cape?
See.
Yeah. So like sometimes I'll turn it off overnight, right? And people's responsibilities are different. Not everybody has the capacity, and people have responsibilities that maybe they can't do that. But finding ways, or I log out of social media all the time, so that I'm not constantly scrolling. I think that's a constant drain.
It is. I tell myself
mental
I'm
energy.
working, but
Yeah. So I think it's being honest with yourself about where you are and being okay to say no. Which I know, listen, I'm saying this, but I struggle with it as much as the next person. Like saying no, I cannot make it. Like I had a couple events in the past month maybe that I truly just could not make it because I had other things planned, and these were last minute invites. But there are people
that you need to go on my calendar in advance.
Oh my gosh!
But I digress.
Yes,
we're grown. Like you can't tell me about something 2 days before and then
no, it was literally the week of.
No, I can't. I'm sorry.
But these are people
out of principle.
These are people that showed up for me in like such special ways,
and
I'm
that's
like,
the worst.
oh my gosh, I can't believe I'm not going to be able to reciprocate.
Yeah,
and I have to say no, I can't make it.
Yeah.
And
you were me tossing on that couch, basically.
It's hard, but that also has to be a thing. I know boundaries is a word that's being thrown around a lot on social media and just in like pop culture and setting boundaries. And I think the difference between setting a boundary and then like just avoiding or being at capacity, etc. When you're setting a boundary, it's an intentional decision, intentional conversation maybe with another person about your relationship with them, right? So let's say they're doing something that is harming the relationship or creating space in the relationship, creating distance, and having that intentional conversation and being able to communicate that's the thing.
That's where we fall off.
Yes. And oftentimes we might choose to then avoid, block, or I'm going to create even more distance. That's the track, right? Rather than having that conversation, because those are hard conversations to have. Like when you say this or when you do this, it makes me feel this way. Again, you have to have a level of awareness of how you're feeling and be
Step one before you can communicate it.
Be able to sit with that emotion to work it out, like to process it. Oh, when they say this, it makes me feel sad or it makes me feel anxious or whatever. And now am I going to have a conversation with them about that, or am I just going to avoid it by blocking them,
moving accordingly,
right? Or not saying anything.
Yeah,
not saying anything is also a form of avoidance.
I'm facing that right now, but that's my business. I think like the best way I can describe it, I'll give an example for the practical. From a therapy standpoint, like I really learned, especially in my earlier to mid 20s, you can't assume that people know. You have to communicate to them. It still irritates me though. Like because I've done the work to do that, it's like a muscle, right? Like I understand I have to go work out if I want to have an ab, maybe one of them. But I don't want to do that. So it's still something I have to almost make. Sometimes it's fun. Sometimes I'm like over communicating now, but like it's not my default.
Yeah.
So if I meet people who almost are like maybe hypervigilant or anticipate my needs the way I try to do for others, it's such a breath because it's like, oh, someone can do it for me too. But that's rare, right?
Yeah.
So because I'm already putting in the effort to communicate, if I feel like, I told you before, I don't like to repeat myself. I like tell you one time and see the change. My therapist was like, that's not how it works, but whatever. I told you. I did all the work to tell you in the first place. So if I have to keep telling you, it makes me want to not have the conversation moving forward because I feel like it's not making a difference. Or if I feel like there will be no point in having the conversation. And I think you clogs my tea of like, it's avoidance, but sometimes I do wonder, is there a line of
what is your capacity? Do you think it's worth saying? Because some stuff is understood, and I going back. Maybe I'm defaulting a little bit, but some stuff it's like you know how to treat people in a certain scenario. I shouldn't have to tell you, hey, the way you treated me was made me feel this, because you have enough common sense to know that.
Exactly.
So finding that balance, how would you say, like, not to turn this into my therapy, but I'm sure someone can relate, and we're moving to the bid section, which is like listener letters anyway. But how do you find that balance of like, this is not worth my energy?
Yeah.
Versus you just don't want to give your energy.
Exactly. Yes. Yeah. And I think that there is a line, first of all. Validate that.
Okay, thank you.
It's not just about continuing to give people a chance after chance after chance, especially after you have gone through the hard conversation and done the hard work of communicating how you feel earnestly, right? Like, setting boundaries is an opportunity to give the other person a way to re-envision the way they interact with you, right? Here's your opportunity, because I just told you how it made me feel.
So let me see what you're going to do with that.
Right.
Apply my notes.
Exactly.
Literally, when Beyonce was like, I don't see why I would give any more when I haven't seen my notes applied. That's exactly how I feel.
Right. Right. So there is a line that needs to be drawn eventually. And I think it depends. So one of the things that always blows my mind is our connection with our families and how deeply rooted those are, especially in our community, right? Such that it's to the point where, like, I will bear with you more than the average because I love you deeply, right? But aside from that, I think, like, the line, there are a couple of things that you can look at, right? So how many times have you had this conversation? Has the person tried? Have they improved at all? Or are they totally just trampling on your boundaries and trying to see how far they can get, right? Are they trying to find a way to skirt around the limit that you put up, right? What is their heart and what is their intention? Can you discern if they are truly trying, right? Because we all have our own stuff that even makes us liable to transgress boundaries, right? We think about 1 to 2 generations above us.
Yeah. They don't believe in that.
And sometimes, our relationships with our parents, and if you're trying to communicate to your parent, hey, when you do this, it makes me feel this way. A generation or two above, you couldn't say that,
They were like,
right?
horrible trauma, literally. See? Now that's what I call trauma. That's going to be the episode title. I'm just kidding.
So for some
Tools.
people,
They don't have the tools. They don't have the knowledge. It all
right.
comes back to the knowledge. I see.
They don't naturally have that, right? So it's like, okay, how much can I bear with you, patient? As I can see you're trying, right? And I can
It's
see
sweet.
that you care about me and you've shown it in other ways.
That's what I have to remember.
And this one area still needs work.
We got to work on this.
Right.
Yeah.
And so I think there are ways that you can kind of monitor how things are going, track their progress, and if they're really actually wanting to change in order to keep the relationship in a healthy place for both of you, right? Or if they are not listening to what you have to say, there's no humility, there's no acknowledgement even. Like, can you acknowledge that what I just said, when I said I was hurt, can you acknowledge that you hurt me? Or are you going straight into, well, here's why I did it, and it was for your good, and, you're going right into explaining your behavior.
Yeah, facts.
Right. So,
got you. Would you say that the conversation is always necessary then? That's first step or second step after understanding what you're feeling?
what conversation? Like conversation about boundaries?
Yeah, like I think just even thinking about emotional responsibility specifically, I guess, in our relationships. It sounds like, just to summarize, you're saying like being able to be honest with yourself, assess what you actually feel, and then giving someone the opportunity by communicating it.
Yes. I think of course, depending on the nature of the relationship, maybe it's not, maybe it's somebody that you met at a party, you may never see them again. It's like, do I really need to go out of my way to tell you how I feel?
To give my energy to that, yeah.
Probably not, right? But if this is somebody you're building a relationship with, or a friendship that you've had, or somebody that you care about, and there's a reciprocal, adoration for each other, then it's like, yeah, I care about you enough to tell you that this is how it made me feel. I still want to be in a relationship with you. And moving forward, this is what would be helpful for me. So I do think it's worth a conversation. I think it allows for growth on both ends. Because one, to bring that to somebody is a lot, right? It takes a lot of courage, even trusting that the connection is strong enough to withstand it.
Facts.
Right.
And I feel like sometimes what leads people to even have the conversation is repeated behavior.
Mm-hmm.
So I almost feel like another block there could be like, you've done this multiple times before and maybe I haven't said anything.
Yeah.
Right. So I think that's what leads people to maybe be like, it's not worth talking about. But would you say that's not fair because they should have talked about it in the first place? Or
I think accountability has to start with the first conversation. So if you let it go on for 10 times, and then on the 10th time you say, hey, this has happened 10 times. You can't really hold them accountable if they didn't know, if you weren't saying anything, right? Although it's still...
Shouldn't they have known?
Although irritation... Shouldn't they have known? No.
Okay.
Yeah. I don't think you can... Especially because people, again, have their own backgrounds and histories and etc., where they're not seeing the fault in their behavior, which is why I think it's important to be around others and to be in community. Because when you're by yourself and you think you're the best thing since sliced bread, of course you're not interacting with anybody else who can point that out, right? Of course you're going to think everything you do is great because you're not allowing other people to speak into your life, right? So should they know if you don't tell them? I don't think that's necessarily a fair standard to hold someone to. I mean, of course, there are extreme circumstances that you
shouldn't walk up and slap folks in the face.
Right.
We want to be clear. That's not your job to tell anybody well.
Right. So not excusing, of course,
bad behavior.
But when it comes to the other things, right, I think that, sometimes people really don't know the effect of their behaviors and things that they're doing. Like I'll have people come in sometimes and just be so lost about why they can't develop or maintain relationships. And then they're telling me examples of what they do. And people are just leaving, right? Like, I'm not going to deal with that, whatever. But they are never getting any feedback besides abandonment. And then that leaves the person
thinking everybody leaves me instead of I'm the common denominator. Something's afoot. Okay.
Yeah.
You're so sweet because I would be looking at them like, that's also why I couldn't do it because my facial expressions would be like the whole session. Like,
honestly, though, facial expressions are there. So it could be.
What's that mean?
That means you can use your facial expressions to communicate things to patients. Right? So if or communicate things in general.
My girl, my therapist, the other day I did something and she goes, I noticed you cut your eyes. I was like, damn. Whoa. Can I breathe? But she was eating because she you have to develop that relationship, which we'll do a separate episode about therapy and why it matters. Yeah. But developing that relationship, right? I'm sure you can say with your patients, then you recognize oh, when Marissa does that, she might be getting ready to cry or she might be swallowing something or whatever.
Exactly.
Right. So
I think nonverbals
so important.
Can be more, they can say more than your words, right? Because you're trying to hold it in. Trying to, your body's trying to find ways to not let some things out, but then you give it away. It's the foot tap, it's the, it's the looking down, it's looking to the side. It's so
Lord, I'm gonna be like this.
And that says a lot too.
No, yeah.
How do I know? Literally,
I'm just gonna go off camera.
One of my supervisors would always say, it's all grist for the mill, which means everything is data. And that's something you learn in your training, right? So the nonverbals, even what you say, there's a deeper meaning. There's reading in between the lines, like what comes out of patients' mouths. And so it's all grist for the mill.
I love that.
And I learned to turn that off when I leave the office.
Hello? Because then you'd be like, Marissa's twitching. And I'm like, I just have to sneeze. And just to wind us down, we have this section on the show called Bid. So it's questions, letters, etc. that people can write in and ask. Yeah. And I kind of am going to combine it because I feel like essentially we've talked about this a bit, but it's how do I stop maybe over analyzing / labeling everything I feel or experience. And I also am curious, I would love a key takeaway of once you figure out how to stop that, what does emotional responsibility really look like?
Yeah.
So
Yeah.
2 for 1 to close
Okay.
this out.
Yeah. So when it comes to overanalyzing, I think that's something a lot of people struggle with, right? And and when that happens, I think one of the things I'm always struck by too, and I think it's natural. So I think it just comes from seeing so many people struggle with it. But it's hard for people to actually understand what's going on in their mind. Like if you're saying you have anxiety, anxious thoughts, and you're overanalyzing, what is it that you're overanalyzing? What is it that goes in your mind verbatim? And a lot of people draw a blank. They're just like, I don't know. It's just, it's just an experience that happens. And I think the more you can unpack that experience, because it's hard to change something when you don't know the ins and outs of it. You just know it happened. And so, can we unpack that? Can we process? Okay, what is your brain saying? Is it about bills? Is it about the current state of the world? Is it about what that person said to you last week? Like, can we unpack what is it that you actually are overanalyzing? Even to the extent of verbatim. Like, what I heard was, I'll never be anything because I messed up at work on Friday. And it's like, oh, okay. So that's what you're hearing, right? So let's unpack that, right? So there's a certain level of insight, but it takes work to get there because people are kind of starting with this conglomeration of things. It's just like a yarn ball, right? And it takes work to unravel that. Once you're able to build insight into, oh, okay, this is what I just told myself, this negative thing or this anxiety provoking thing, can I understand what the function of that is? Like why would my brain tell me that? What's the function behind I'm never gonna be anything or right? Oh, okay, yeah. My brain is trying to protect me
Protect
from
me.
failure
Yeah.
or protect me from repeating that mistake. And this is the way that it's chosen to warn me.
Not me crying. Yeah.
And there are
Because
other
it's so sweet, really.
it is, right?
It's just trying to help you, but
It
it's
is.
not helping. But go on.
Giving yourself grace with the process that maybe was formed over time and maybe was formed throughout the way that you were up, your upbringing and how feedback was given to you and your households, right? That like mom and dad say this because they need to get it across and they don't know any other way to say it, right? I want to warn you so that you don't become a screw up in life. So I'm going to tell you straight up, right? Like
Yeah.
that's some
people,
that's
definitely.
some parenting styles.
You can tell when people are raised like that because it's like, why would you say that to me like that? Are you okay? But yeah.
Right. But then it becomes your own inner dialogue.
Yeah.
And that inner dialogue goes unchecked for years and years and years. And it's causing you this anxiety and it's causing you this depression or whatever else. And it becomes this ball of yarn. And now you're walking around with that kind of beholden to that pattern. And it really starts with being able to like, okay, can we eat one string at a time with grace for the process, grace for yourself, be able to unravel some of that and understand how you got there and also what's the function of that. And I think once you know more about that, you can choose to do differently because I know what's going on now. I know the process. I know the pattern. I can name it that is what's happening right now. And that's not the way I want to move forward, on this Tuesday afternoon or whatever
Hello?
day or time it
Literally.
is, right? That's not the way I want to move forward right now. I have too many other things to.
Hello, bigger fish to fry.
Exactly. So I'm going to stop this pattern consciously because a lot of it happens subconsciously, right? A lot of people just walk around in anxiety. They have no idea why. Oh, it was just one day I just started crying and I don't know why. And that's what I think a lot of people will come in with and they're just like, no, I just cry out of nowhere for no reason. And that's like, okay.
That's not,
Let's
unless you have a
pause.
tick. That's not it.
Let's pause because they're so cut off from their emotions or they're so cut off from themselves.
In the inner world.
Exactly. That they didn't even realize what's going on. And again, it takes the introspection, but it takes being with somebody who is trained to help you see those things and do those things. I think having, of course, great friends as well who can speak into your life and also trained professionals
Hello.
who
Can't stress that enough.
Yes, who are trained to be able to pinpoint what those things are and to walk alongside you in that with grace, with love, with peace. So,
Right. And
yeah.
that hopefully will slow your over labeling, because then
Mm-hmm.
you'll have actual tools and resources and someone who's trained to really label, quote unquote. I don't even
Yeah.
think, though, at least my therapist, sometimes I'm like, tell me a name of something,
Mm-hmm.
She's rarely like, this is what's wrong with you, or, ever.
Exactly. Yeah.
Like she said to me the other day, not to be too TMI, but she was just like, she also is faith-based, which I personally
Amazing.
need, but
Yeah.
she's like, pray against the spirit of abandonment.
Mm-hmm.
And I was like, well, first of all, that's the Lord working through you. But also, I know that I really struggle with that. I don't
Yeah.
this is maybe the one kicker, which we've got to wrap up. This is not a therapy session for me. But
Mm-hmm.
I don't know really where it comes from, because I
Yeah.
wasn't abandoned by my parents, anything like that. But I really struggle with it. I always think people will be like, if you're not perfect, they're out. Or if you don't do this, this, and this, or you don't bring this to the table, it's a wrap.
Yeah.
And so it was just funny, because I was telling her about thinking this thought and being afraid of this and etc. And she said that, and I knew, okay, these are symptoms of the wound that I'm
Yes.
familiar with,
Yeah.
instead of going around. But I wouldn't then go around and say, I carry the spirit of abandonment and that is who I am, So
Exactly.
I think there's power in being able to name the thing, for sure, especially as an intellectualizer. It gives me peace.
Yes.
But sometimes you won't be able to name it. You simply just have to treat it.
Yeah. Yeah. And I think, you bringing up the fact that your therapist usually doesn't answer questions directly, which I know a lot of people want, right? Because again, they're trying to understand what's going on and make meaning and etc. And it's more so about the process too, right? And so I think recognizing and understanding that, and when it comes to emotional responsibility, yes, it's about learning the tools, right? Again, social media is a great way maybe to get introduced to the topic of mental
Get you
health.
curious.
Yeah. People sharing their experiences and the ways that they've overcome things and etc. When you start to take on the identities of the labels they're coming up with, right? Like, oh, so I am this or that because I have the same experience.
Right. Same thing happened to me.
Right.
And now you think you got BPD.
Right. You
what?
take on the identity
Yeah.
or the label, and then oftentimes it kind of can skirt accountability, and it can lead to avoidance, right? Because, well, now I know what I have, right? And I'm going to go through life kind of blaming any inconvenience on this label, right? But I think if we're being responsible about our emotional lives, we are able to have humility in knowing that our emotions are complex and they're multifaceted. So oftentimes it can't just be dwindled down to it's this one thing that happened. Oftentimes we experience several emotions at the same time, and those emotions might be conflicting, right? So that leaves us in a place of what do I do with all of this? And I think sometimes on social media, it's packaged in terms of this is the perfect explanation, right? Everything packaged together, when it's actually, if we really take a look at the whole picture, there are many factors at play. It's not just that one thing. It's complex, right? And it's multi-layered and multifaceted. And so having humility and knowing, okay, this is a lot. It's not just one thing. Being able to be vulnerable, right? That's a responsible way. Vulnerable with the right people, of course.
Can't stress that enough. I'm learning that.
Yes.
Every day.
With the right people, with trusted people, whether that's a professional or if that's a friend or if that's a family member, etc. Trusted leader in the community, etc. And then taking the tools that you're learning and using them for good, not against people. Because I think folks who have been in therapy for a long time, they have a lot of language. They have, this pride about the work that they've done and etc. And then they can start to pinpoint it in other people. Like, oh, I was there. You just got to keep growing. You'll learn one day, right? And they can start to look at people in a different light. So using them for good to be able to help others rather than to find a way to further puff yourself up. But yeah.
I love that. I feel like we touched on so much, why therapy is important, which, I say every chance I get, but also like seeking, I mean, that's in the Bible, to seek wisdom and understanding,
Absolutely.
right? Versus just taking something and running with it, because often that can be more harmful
Yeah.
than helpful, even when you're trying to use it as a tool to help.
Exactly.
But I do think you corrected me a bit on like being triggered and trauma, and all those things are spectrums. And so someone could very well feel that way. Maybe it's not about us using the language too much or like lack of understanding the language, but just maybe not stopping at only using the language and going a little further as to why we're using it.
Yes. Yeah.
I love that.
Exactly. So if you say something triggered you, okay, it triggered you, right? Who am I to say it didn't? Even if I don't feel like it was worthy of a trigger, right?
Yeah.
Let's talk about it. Let's unpack it. And then that's where the real work is. So, yeah.
Well, thank you so much for coming.
Yeah,
like,
thanks
honestly,
for having me.
this was free. I wish I had a Patreon, because this should have been some type of funding back to your practice. But we'll obviously drop your Instagram and such things. Don't bother this lady. But if you want to get some inspiration and resources, and we just really appreciate you coming. And we're rooting for you guys to have more capacity, be less triggered, and heal your traumas.
Absolutely. It is possible.
It's possible.
It's possible.
Live and prove.
Yeah.
And we can't wait to bid on you. See you next time.